Hey everybody, welcome back to the How Did It Happen podcast. I'm your host, Mike Malatesta. I'm an entrepreneur who's founded and led 2 8-figure companies. I'm also an investor, author, speaker, and lifetime learner. On this podcast, I explore stories of success in every episode and with every guest. What it means, why it's important, and of course, how it happens. You can subscribe, connect, and learn more about me at mikemalatesta.com. Before we start today's episode, I wanted to tell you about 2 quick things. First, thanks to you, this podcast is in the top 2.5% of all podcasts in the world. My goal is to earn my way into the top 1% group. You can help me with this by sharing episodes and leaving reviews. Second, my new book is going to launch on November 30th, 2021. It's called Ownership. The subtitle is How Getting Selfish Got Me Unstuck. I'll let you know more about how you can get it as we get closer to launch. Hey everybody, welcome back to the How Did It Happen podcast. I'm so grateful to have you listening today. And I'm also grateful that you come back every week and listen, because I get so much energy out of talking to the wonderful people that I get a chance to talk to, and having you benefit from it as well just makes it all that more special. So thank you so much for listening. And today I will not disappoint you, as I never do, because I've got Kara Bowman with me today. And Kara's story, her short story, is that after a career in corporate and nonprofit jobs, she changed directions to become a licensed marriage and family therapist. She finds great meaning in talking with others, immersed in the messiness, rawness, pain, and beauty of life. By the way, Kara, I love that. And she's passionate about learning and passionate about helping others heal and grow. She's also an author. Congratulations. Her book is called Heartbreak to Hope, Poems of Support for Grief and Loss. Kara, welcome to the show.
Thank you. Thank you so much for having me.
Yeah, I've been looking forward to this because as I was telling you before we went on, I've never had anyone with your skill set and background on the podcast before, which makes it exciting for me. But I think it's going to be great for the listeners because you are going to be able to share your experiences with therapy, family, and marriage, and all other kinds of therapy and practices that you do. I was checking it all out. Some of them I don't even know what they are. And it's something that resonates with everybody because we all have something in our life at some time or another that we need help dealing with. And you're the perfect person to help people. And so I'm grateful for this opportunity. I do want to say too, I read on your, I wanted to just get this out because your client comments I thought were amazing, Kara. These are unsolicited comments from people who have had the chance to work with Kara. I was seen and held with compassion and non-judgment for my worries and fears. That gave me the courage to be with them. I thought that was amazing. And the other one I thought was amazing was, what can I say other than you understand me? I mean, I don't know how you could get a better compliment than that from someone who you've helped through a difficult time. So, Kara, I start every podcast with the same simple question, and that is, how did it happen for you?
How it happened for me was everything in my life kind of came together. Everything personally that I'd been through, everything career-wise that I'd done. One of the reasons I think I could get comments like that from clients was I had a previous career. I'd been out there in the world, in the corporate world. So I do understand the challenges of that. I didn't just go into therapy immediately after graduating from college. So I understand what it's like to hold down a job and maybe a marriage and kids. And I understand what it's like to deal with some of the challenges of life, grief and loss and stress and family problems. So everything kind of informed who I was, and I learned along the way, and I ended up putting it all together into a career that could use everything that I had learned and been through.
And was there something that happened in your life or along your career that was sort of the trigger for you making the I call it transforming or transformation. I don't know what you call it, but that's what the word that came to mind when I was reading about you. Was there something that came along specifically that made you think, huh, maybe I should pivot onto a different track?
Absolutely. So if you've got a minute, I'll tell you a little story. um, I went into corporate world right out of college, mostly because I was told I should do that. I was really good at math. I ended up getting an undergraduate in economics and a graduate degree, an MBA from Berkeley, and I went into corporate finance and leverage buyouts and consulting and that whole world in San Francisco and then later in Portland. And I didn't enjoy it. Part of what I didn't enjoy was being a woman in a male-dominated world. This was the early '80s, and partly what I didn't enjoy was the lack of meaning it had for me, even though I really did enjoy numbers. So I found myself doing that and moved into nonprofit management and looking for more meaning, and moved into opening my own daycare center in Portland, which was a very large operation. It had 215 kids enrolled and 26 teachers, and found a lot of meaning in that. Enjoyed management, won a lot of awards for mainstreaming differently abled kids, for working with the foster care system. Felt like I was doing a lot of good, but the financial stresses were just constant. Um, and I didn't enjoy that part of it. And I ended up moving back to California and found that after years of doing that job, I wasn't qualified to own a daycare center or direct a daycare center in California, which was rather shocking. They had different rules down here. Um, ended up I don't want to get too much into this part of the story, but ended up homeschooling my kids. I pulled them out of a private school in the middle of the year and found that, much to my chagrin, they didn't want to go back to school next year, and ended up homeschooling my children, which was a little uh, wiggle in my career that I didn't expect, and was kind of looking for the next chapter in my life, trying to figure out what I wanted to do when an unbelievable series of events occurred. And this began with our best friends, husband and wife, being murdered. And absolutely shocking, out of nowhere. And then shortly afterward, my husband developed H1N1, which was swine flu, and was in the hospital was in the intensive care unit in an induced coma for 42 days. And they didn't know whether he was going to live or die. They brought me in 6 times to say goodbye to him because they thought he was imminently dying. Immediately after that, my son developed a cancer, lymphoma. We had multiple friends die, 2 of cancer, 1 of a tree falling on him, 1 of suicide, 1 of multiple sclerosis. And then my daughter developed a different kind of cancer.
Oh my gosh.
And I have 3 children, so 2 of the 3 developed cancers. This was in a 5-year period. And then my husband developed cancer, leukemia. So when you ask if something happened, I smiled. Yes, you could say something happened.
Yeah.
Um, a few things happened. So before before this period, I had been, just like a lot of people in midlife, dabbling a little bit in self growth and learning a little bit about myself, and going to some workshops and seminars, reading books, that kind of thing. And when this happened, I kind of felt like I had been through boot camp and I had some of the knowledge, and now I was thrown into war, and I had to take some of the knowledge I had that was theoretical and use it. And I remember, for example, when they told me it didn't, for the first time, it didn't look like my husband was going to live, my head was swimming, and I sat down on the floor in the hallway in the hospital, and I said to myself, Kara, you can handle this in the old way that you've always handled things, which is kind of overwhelm and panic and trying to control, or you can handle this in a new way. And my new way was presence. It was not going to the future. It was not inducing anxiety by worrying about what was going to happen. It was not looking at the past. What should I have done? Should I have gotten him to the doctor sooner? Should he have not gone to this meeting where he caught this? But it was, what do I know now? How do I feel now? What I know that he's alive right in this minute. I know that I am sitting here on the floor of the hospital. I know that I'm safe. I know that my heart's beating. I know, these are the things that I went back to. My breath, my heart, my body temperature, touching him, feeling him, his body. And that's how I got through the 42 days, and then the recovery afterward. His muscles had wasted away. He couldn't walk. He had a feeding tube. He was on at one point 22, I think, IV in, IVs. It was just incredible, the amount of intervention. So he had a long recovery from that. And then we went to the murder trial for our friends. What happened was, the family didn't want to go for their own reasons, and the lawyer told us that it didn't look good to the jury if nobody showed up to represent the people who were murdered. The people in the audience kind of stood in for them. It kind of looked as though nobody cared about them if nobody showed up. So we went to that. It was horrific. And I got through that the same way, with presence, with just dealing with whatever I had to deal with in that moment, and giving myself compassion for whatever was happening in that moment. So through the stress of all of these situations, my children's cancer, my husband's cancer, it's kind of like forging a diamond under pressure. I forged a new way of going through life. I, instead of going toward my own coping mechanisms, I learned to be present, and I learned to have self-compassion. And I did it through, they call it post-traumatic growth. You can actually grow through trauma as well as be scarred by trauma. And I was scarred by trauma too, but I actually grew through trauma because I chose to use it.
And
So
had you
that's what
already?
happened to me.
Yeah. Okay. Well, there's a lot of horrible in that,
There's a
but
lot of horrible.
yeah. But your husband, your children are doing fine, or
My
where are they?
children are considered cured. My husband's cancer is not curable. It's kind of got a very long-term prognosis, and he has to be treated repeatedly. Um, so he's kind of back and forth between illness, and this pandemic was very hard on us. We isolated more than anyone I ever knew. I'm very fortunate that I could do my job while isolated because I could do it on Zoom.
Right.
and we isolated. We were washing our groceries long after everybody else had given up on that, but we couldn't take a risk of one little germ getting in because he's extremely immune compromised. So he still has health challenges, but for now he's doing fine. Yeah. So what happened was my I went through all of that and developed tremendous empathy for people and what they went through in grief and trauma. And and as I had been looking around for what else to do with my life, knew that I'd always been interested in psychology. I'd always read about it and decided to go back to school and become a therapist, and did it in a way I've never done anything. I'm always a researcher, and I just did it on a whim. Um, and immediately was drawn to grief and trauma work. Most therapists don't specialize. Most therapists kind of see the gamut of whatever's out there. But I specialized immediately and started working with hospice and did some advanced certifications. I have an advanced certification in grief. I have an advanced certification in trauma, and I have an advanced certification in something called Thanatology, which is the study of death and dying. And then along the way, I also became a certified trainer in nonviolent communication, um, which is a method of learning more about yourself and your needs and how to connect with others and their needs.
Okay, so basically a way to express yourself in a non-violent way, but still be able to get your point across. Is that, or
Yeah, that's a good way to put it. Nonviolent is kind of used in the 1960s way of equality of power,
okay,
um, rather than actual physical violence.
okay.
So it's more of a compassionate communication is another thing it's sometimes called. Mhm.
So Kara, you mentioned as you were talking there that you, as a result of going through all of these things, you developed empathy for others. And I'm wondering, as you said that, I thought to myself, how did you develop the empathy for yourself? How did you figure out how to, change? So get away, in a lot of life, being future focused is good, but going through what you were going through, future focused was not good because you could only imagine a future that wasn't as good as right now. So, being present, you said, and how did it sounded like your natural sort of proclivity was to look to the future and go but you figured out how to put that aside. Did that happen on your own, or did you have some help yourself doing that, or was it something your family was helping you with? Or because it's sort of like I'm sort of thinking like someone saying, you calm down, relax, it's going to be fine. And that's the last thing I want to hear is calm down, relax, it's going to be fine, because I have to change my mind in order to accept that. And I'm not in a position to accept that right now. So how did you go through it?
No, it's a great question. And our culture absolutely does not teach us how to be with difficult emotion. It teaches us just to shove it aside and move forward. It teaches us how to be in our minds, not our hearts. And so it was something I had to learn. And I learned it not all at once, but in many different small ways. And I had a lot of help. I had help in therapy, but I also I'm just a learner, and so I I learned it through nonviolent communication, and so that was started by Marshall Rosenberg, and anyone can learn that, and that was a big piece of my personal development. I learned it through something called focusing, which was started by Eugene Gendlin in the 1960s, and that has to do with getting to know your own self and your own wisdom from the bottom up through your emotional knowledge and wisdom rather than your head. We tend to just stay in our heads, and we have a lot of wisdom in our emotional reactions, and he teaches you how to tap into that in a very how-to way. Also through Tara Brach, she is a Western psychologist and a Buddhist teacher, and she has online weekly talks, and she has a system that she's developed that teaches self-compassion. Um, and through other methods too. There's a woman called Byron Katie, and she has a way of dealing with thoughts. So there are a lot of different teachers out there. And what I tended to do was read or watch or learn and apply one thing to my life for maybe weeks until I felt like I had integrated it, maybe a gratitude journal or maybe a presence practice. And then once I felt like I'd integrated that, and I would move on to something else. And I've been doing that for years and years and years now. And so slowly, I think of it as shifting the trajectory of an ocean liner. Slowly, I'm shifting the trajectory of my ocean liner to move someplace else. And it's through a lot of little practices that become habits.
Okay. And when your husband was in this medically induced coma, how, and so you're worrying about him. You're also taking care of, you've got 3 kids at this time, right? And so you're trying to be strong for them. And how did they rally around you and help? I'm just trying to understand, because I've never been in that situation. I mean, nothing close. And you have, and it's not just that, you've got these other things happening to your friends and all. It's like, how do you, and you're schooling them maybe? I don't know if you're still schooling them. It's just like so much.
It was an odd time. At the time that happened, my son was in high school and my 2 daughters were in college. So I wasn't quite as actively involved in their lives, but it was an odd time because that's the time of life that kids would normally be separating from their parents. And our family really came back together. My kids came home from college and were in the hospital every day because the doctors told us they should come home. It looked like he wasn't going to make it.
Right.
So I tried to do that differently too. In the past, when I was raising them, I thought a good parent had all the answers. And I thought when they came to me not knowing, that I should reassure them by having all the answers. And what I did was I told them, we're all going to respond to this differently, and that's okay. One of my daughters didn't want to be in the hospital much. My son wanted to be in the hospital as much as he possibly could. Um, some people like to distract a lot, and other people like to really go toward. And I said, however we handle this is okay. Let's not judge each other. And I also said, when my kids got sick, I said, I'm going to try to support you the best I can. And sometimes I'm going to overstep and jump in when you don't want me there. And other times I'm going to probably back up and try to give you independence because they were young adults. And when you would rather have more support, and please just let me know and help me adjust. So I just tried to lay it out on the table that I was doing my best and I was going to mess up, and asked for them to be on my side and to help me support them rather than judge me and push me away. It's very easy to take your own hard emotions and project them onto somebody else and push away the people that we love and need in painful times. And so I was really glad I had a few skills under my belt, not as many as I wish, but a few.
Okay. Well, it sounds like you had more than a few. So when you described it as making a decision, sort of deciding on a whim that you were going to, pursue an education in therapy. And was that, this is probably a dumb question, but now that we're sort of been in the pandemic and online all the time, I'm wondering, was your schooling then something you went to? Was it like you went to
Yeah, my schooling was 2/3 in person and 1/3 online. Back
Okay.
then. Yeah, and it was an evening program because that was the program that just happened to be the one that was a program that was nearest to me physically. I'm in a small town. I'm in Santa Cruz, but I wasn't working in the days, and it worked out pretty well. It I What was interesting is I was thinking when I signed up for the program about learning more than I was thinking about becoming a therapist. And when I got out, I found that the job didn't fit me exactly. And so this is something that some of your listeners might really relate to. It can be really hard to find a career that fits you. And I found that especially working in grief and trauma, it was overwhelming to sit with people full time, the way I wanted to sit with people, being fully present and really empathizing in a felt way with wherever they were. And so I was setting up my website and looking at other websites, for example, and I stumbled upon a woman's website, and I noticed that therapy was one of several things that she did. And I decided to use that as an example for myself, that I was going to do therapy part-time and I was going to pursue other interests that were tangential to therapy with the rest of my time. And so I also volunteer at hospice. I train other volunteers. I train group leaders, and I train therapists at hospice. And I sometimes see individual clients if somebody's got very high acuity. And I also do trainings for therapists in the community. I also speak both to community groups and to therapists. And then I've written this book. I've set up a website to help people who have some PTSD and they have a startle reflex. So I've kind of spread myself into a lot of different projects and that interests me. And therapy is only one piece of that, so that I can give myself totally to therapy without being too overwhelmed by it or burnt out by it.
Okay. Well, I'm glad you explained that because I think it's natural. Like I was thinking, how did you deal with those 5 years that you were talking about? And then I was thinking, boy, oh boy, after you deal with that, how do you deal with, helping people, through, I don't even want to guess all the different things that you've helped people through, but you only have so much energy in a day, and and as a human, you can't just put that folder away and that thing is done until the next time the person comes. So that was interesting how you explained that. It sounded to me like you were saying, reading in between the lines, that you preserve your energy for helping people by not helping people full time, by doing other things that complement your mission to help people, but take you out of the environment where you're sort of directly one-on-one doing therapy with someone. Am I anywhere close to that being like your rationale for it?
That's exactly right. Uh, for me, I really like to be emotionally present with people, and so that can be draining if it's too many hours a week. I also deal with that piece of it through perspective. And so I'm really proactive. When I was at hospice seeing clients in my training, every time I touched the door on my way in, I would remind myself that there are 7 billion people in the world, and the vast majority of them didn't die yesterday. Because you can lose perspective and think that everybody's dying all the time.
Right. Okay. Sure. Especially with hospice, right? Because that's what people are doing when they're in hospice. They're dying
That's
typically, right?
exactly
Yeah.
right.
Okay.
And so I remind myself of my clients' resilience. I remind myself that the people I'm seeing are not representative of everybody in the world. I remind myself that I'm seeing people when they are struggling and need help, and when they're feeling better. That's when I don't see them. I remind myself that I got through things and I had the strength to get through things with support, and they can also get through things with support. Um, it's easy to um, take a a still shot of the worst moment, for example, when somebody dies, and think, oh my gosh, that person is just crushed. How are they ever going to get through this? And I
Mhm.
remind myself to keep the camera moving, and that it's a video, that in 6 months, in 1 year, in 2 years, in 5 years, that the person will be in a different place. So I very proactively give myself that perspective so that I don't get stuck in the worst moment.
Okay.
And I
And
think my clients can feed off of that because they can get stuck in their worst moment. And if I have hope, they can have hope.
okay, I love that. And I can totally appreciate how you get stuck in your worst moment because that, to me, that reminds me of what I was saying earlier. You're looking out towards tomorrow and the next day and the next day, your future, and you're thinking, oh my gosh, it's going to be just like today. And today sucks. I don't want that. I can't deal with that. Instead of, okay, today sucks for these reasons. So how can I look at these? I'm not trying to be a therapist here. I'm just trying to understand kind of how the mindset goes. Um,
Sure. That's exactly right. And people say to me all the time, how can you work in grief and trauma? And to me, they're two of the most hopeful fields to work in because people tend to get better with help with grief and trauma. They
and
do tend to get better. Sometimes
right,
mood
right.
disorders like depression can be very entrenched, and I feel like with grief and trauma, I can help people unstick themselves and get better.
And is that because it's those types of things are typically caused by a singular or a uh, series of specific events as opposed to depression, which you may not know why you're depressed, Kara, or is there something more to it than that?
It's so complex. I'm not sure that we actually know the answer. The mind and body are so interactive, back and forth. A lot of the trauma I see is some of it is event-based trauma. A lot of it is what's called developmental trauma, which is a lot of little events over a person's childhood where there's a lack of attunement with their parents. And so a lot of the trauma I see are attachment wounds. Um, and and what tends to happen is that people who don't have attachment wounds, they can deal with whatever's incoming in their life. For example, most soldiers in war do not get PTSD.
Right.
And they can predict with a fair amount of accuracy who's going to get PTSD and who's not going to get PTSD based on the person's background coming in.
Oh,
Um,
is that right? No, so not what they actually experience while they're there. I did not know that. Okay.
exactly, exactly. Um, so the diagnosis, I think, is completely wrong. The way PTSD is diagnosed, which has to do with what happens to you. It actually has to do with how you experience what happens to you, and that has to do with what you take going into the event. And so some people in their childhoods learn resilience. They learn that the world is a safe place. They learn that they can have difficult emotions and they can soothe themselves. And other people don't learn those skills. And those are the people who are going to experience PTSD. Um,
Okay.
and so those skills can be taught. And those mechanisms in the brain and in the endocrine system and in the nervous system can be changed over time. it's not a one-time event to change those, but you can change your physiological reactions, your biological reactions, and your brain. And that's a lot of the new neurobiology research that's coming out is so exciting to me because they're learning how people can change their brain. And there's a lot of application that's coming out of the new research. Depression, um, it's a lot easier to help with medication. However, people who are treatment resistant, who medication doesn't work for, their biology seems to just take over, maybe because of kind of a combination of inherent genetics and environment as a child. And if they're treatment resistant, that seems to be a harder pattern to break um, through therapy.
Okay. So there could be, if a layman here, there could be chemical imbalances in that person that, you know, are just difficult to change. Whereas PTSD, for example, the person may not have that. They have something else that's the childhood thing, or that's the cause, and that could be more easily understood and worked through. Is it?
With yes. So trauma therapy is very different from other kinds of therapy. There are certain therapies that are called trauma-informed therapies, and they're really different from normal therapies, and they work specifically on the mechanisms of trauma. Mhm.
Okay. So when you mentioned you did some training in hospice, when you finally decided that you were going to become a therapist, which you said you were really in it for the education at the beginning, when you finally decided to become a therapist, how were you scared? Like, did you have to convince yourself that I can really help someone, or did you feel like your training was sufficient enough to prepare you where you were like, okay, let's hang the shingle and people start booking appointments and here I go?
I was absolutely scared. It seems like a very big responsibility.
Yeah.
Um, I was fortunate that I had a few skills. One is I was older than some of my classmates. Some of my classmates were right out of undergrad and they just didn't have the life experience I had. And the other was I had an extensive background in nonviolent communication and in focusing. And so those were some skills that I could draw on in as a therapist. So I had some direction and experience sitting with people. But it felt like a really big responsibility. I've had clients who are suicidal. You're responsible in some ways for somebody's life,
Right.
and it's very scary. One thing that a lot of people don't know is that many therapists get consultation. So they either have a consultation group of other therapists or they have a more experienced therapist they consult with. And so if you have a client that you have any questions about, they either feel stuck or you want to make sure that you've turned over every stone, you've got somebody to talk to. So you go in and you talk to them without having any names attached or identifying information attached. You can talk to other therapists who are bound by confidentiality about a client. I never knew that when I was a client, but that does help you feel supported. But it did take me some time to feel confident. And even now, I consult with a woman who is a professor at UC San Francisco. Whenever I want to just make sure I'm going down the right path with a client, um, it's a lot of responsibility. And even without having somebody's life in the balance, it's just a lot of responsibility. People are putting a lot of trust in you. They're paying you a lot of money and putting a lot of hope into you. A lot of trust and hope and effort. And I want to honor that.
Kara, when most people come to you, would you say that they have an expectation that you will help them to the point where they won't need you anymore, which I think is your goal when you have someone? or is it more like, I don't think I can be helped? What are people generally thinking when they come, if there is a general thought process when they come?
Yeah, I see people who are all over the map. And generally, I think people come in because they have a specific problem bothering them. And they get help with that and they leave when that problem's not bothering them. So it might be they're grieving and they just feel in pain most of the time, or they feel stuck with their grief, or they um, uh, let's say they had sexual assault and then they're having sexual problems with their husband, something like that. Sometimes, very often, they work through their original problem and then other issues come up. We discover a mood disorder, anxiety, or depression, or um, lack of trust from childhood, something like that. And then they stay in to work on deeper issues. Sometimes um, people have had very horrific childhoods and they are in therapy because they need long-term support. They hopefully those people are slowly getting better and healing, but some people may need support their whole lives. I'd say out of my whole caseload, I only have maybe two people who fit into that category. So it really varies a lot. It
Okay.
really varies a lot.
I don't know why what you're saying just reminded me of this, but when you're, and I'm sorry to go back to this, but it just occurred to me, when your best friends were killed, did they have children, and did you have you worked with the, I guess, are they, I'm trying to think of how they're going through life, after something like that happens, is what can you say about that?
Yeah, it's a very good question. They had children, and when the night they were killed, neither we remembered that we were asked to take their children if something happened to them, and so did his brother, and neither of us could remember who was first and who was second.
Oh,
And we actually we had to find the will to remember, and we were actually second.
okay.
Um, and um, they took the children directly from the house to the police station, and a therapist met them there, and a therapist who was experienced with trauma. And um, I'm thankful for that, just because you can get some entrenched negative interpretations of an event if 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 there isn't intervention right away. And so they were met with a therapist that very evening. And it has been a long haul for them. They were 12, 15, and 17, I think, at the time. And they are all doing really well right now. They are bonded to one another. They're each other's best friends. And they are, I think, all either in graduate school or have graduated from graduate school. And there were some bumps along the way. There were definitely some hard times along the way, but they all found their way with the help of therapy and each other.
Oh,
Um,
wonderful.
so it's one of the things that I think about sometimes when I remember people's resilience, and I remember to um, keep the long-term perspective that people can heal.
Speaking of resilience, do you mind if I go back a little bit to when you were growing up? Um, I noticed that you went to University of Michigan, which makes me think maybe you grew up in the Midwest, but I'm not sure. I guess I want to understand kind of where you came from and what your life was like as you were growing up, because you definitely got some resilience somewhere, and you've been building on that since. So what can you share with us there?
Yeah. I was born in East Coast on the East Coast, and I lived there till I was 6, Boston. And I say that because my parents are very East Coast Jewish, so that just kind of places me a little bit. And then I did grow up in Michigan. My father was a professor at the Michigan State, and so I was a trader and went to the University of Michigan.
Oh yeah, how'd that go over?
And so I'm very Midwest. And My childhood was one of those that looked good on the outside and was difficult for me emotionally on the inside. And so it took me a long, long time to claim that. And there was a lot of self-blame. What's wrong with me? Why am I feeling all of these feelings when my childhood was good? And now I'm very wary and my ears perk up whenever anybody comes in and just says with a blanket absolute statement, oh, I had a good childhood. Because there's usually more to the story. There's more nuance than that. So in my case, my parents were very, I don't think they were very emotionally adept, and they were extremely busy. It was the 60s and 70s and women's liberation. And my mother was working in a career and very fulfilled in her career. And my father was very fulfilled in his career, and they had friends and they had hobbies and interests. And I was pretty much left alone under the guise of independence. And I was also advanced 2 years in school, which they used to do back then. They don't do that anymore. So I was an extremely shy kid in with kids a couple of years older than me in school, and still not challenged academically. So I had a lot of hard feelings, a lot of anxiety, a lot of depression, and a lot of self-blame about that, and a lot of aloneness, a lot of aloneness. Yeah. And that kind of, I'll just say this for the other lost kids out there. I never graduated from high school. Um, so it's another one of those things I think about when it's not only a great party fact when they say, they say, tell us something about yourself that nobody would ever guess. It's a great party fact, but it's also, it helps me have empathy for other lost kids. I was a lost teenager, and at the time, I didn't know why. I thought I had all the advantages. And looking back, I have a lot of compassion for myself at that point and why. I went to college and flunked out after 1 year because I didn't know how to operate in that venue, and nobody was helping me. And then returned to college after I think about 2 years. I became financially independent and returned to college. So I didn't have the straight through supported path that some kids had.
So that's really interesting. You dropped out of college. So you were an exceptionally smart student. School was easy for you, so much so that you accelerated grades 2 times at least, and still weren't challenged. But it sounds like maybe that wasn't the right path. As you said, they don't do that anymore. But you get to school, you drop. It's almost like I don't know. Did you drop out because you didn't have the study skills, or was it because you were thinking this is too easy? I don't want to waste my time with it, or what was that?
I think it was a combination of not having the study skills and depression and not knowing how to negotiate the adult world. This was way before Google and the ability to find out any information on my own. And I was a very shy kid and I didn't know how to ask for help.
You were
And
also like 16 years old then, if you were
I
2 years.
was 15 when I entered college,
15. Okay. Yeah.
15 when I entered college, and couldn't drive. And yeah,
So 15, so you drop out, and then 2 years later, you're financially independent, which means you went and worked somewhere, and then you did it on your terms. So you went back and you. That's amazing because so many of those stories, Kara, end up where, yeah, I dropped out, and then my life went, like this. Instead, I was destined to be in a something else. I wasn't destined to be a college graduate or whatever the thinking might go. So
absolutely. And when I look back now, I don't know where I always had this core of strength, and I don't know where it came from. And I look at my clients, and so often I can see that inside of them. I can see them suffering. I can see them in pain. I can see their anxiety. And I can see some core of strength that wants to heal, wants to grow, wants to feel better, wants to be healthy.
hmm.
And sometimes just reflecting that to them, pointing out when I'm seeing that and how I'm seeing that can help them see that in themselves. And I don't know where that comes from, but we all seem to have that, this desire to be whole, be integrated, be healthy.
Right.
And if we can tap into that, we can do amazing things. We can become our potentials.
Right. And maybe that's what we're all put here for in the first place as humans, right? To
So, what's sad to me is I think we have that when we're born. Babies know their
Yeah, right.
needs and they communicate their needs, and we somehow lose that. We somehow lose that. We learn language and we start getting disconnected from our emotions, which are our truth, and start living in the world of our head and our thoughts, and disconnecting from our reality. And it's a journey back to our truth.
Well, you said it yourself when you at the beginning of this podcast when you were talking about going into I don't remember if it was venture or private equity or something, and you said something like I did that because that's what I was told I was supposed to do, which is exactly kind of what you're saying there. So let's talk about your book for a little bit. This Heartbreak to Hope: Poems of Support for Grief and Loss. These are poems that you've written. And what were you just writing poems as a result of your interactions with people and your that you were helping, or did it start earlier, or did it begin for some other reason? How did this come together?
Well, I hadn't written a poem since high school English class, I think. And what happened was I was sitting with all these grieving people who wanted support, and they just didn't have the mental bandwidth to read books. People kept giving them books, and I would recommend books, and they would even ask me for recommendations, and the books would pile up on their nightstands unread. They just couldn't focus on reading books. And I thought, how could they get support in a way that they could take it in? And I thought poetry was the perfect avenue for that, especially short poems that were easy to understand. I've never been a lover of poetry that needed a lot of interpretation, that
Okay.
was hard to understand. So I thought, I'm just going to see if I can write this or not, and write some of these or not. And I would wake up in the middle of the night with a poem or some words or some phrases in my head and jot them down. And what I would try to do is capture one little aspect of grief in each poem. And so I would think of a client, or I'd think of my own grief, and I thought of it almost like a kaleidoscope, and capturing one color or one little picture, one little scene, so that people could feel recognized. They could feel like they had words for something they were feeling, but they didn't have words for. And maybe that they would feel less alone, because if this was in writing, somebody else has felt this before. So the book kind of wrote itself. It just flowed out of me. And then I thought, well, I'll I'll self-publish this so I can give it to my clients but maybe I'll see if I can get a publisher first. And it somebody picked it up almost immediately. And then they moved up the publication date because of COVID, because unfortunately, COVID has really impacted the death rate in this country.
Mm.
So it all happened very quickly. Um, yeah. And I could read you a poem if you'd like.
Sure. Yeah, that'd be
Just to
great.
give you an example of, um, let's see, this is one I consider a little bit educational in terms of how to grieve. It's called Love. Um, Take good care of your precious pain. Wrap your strong arms around it, hold it against your warm chest, rock it gently, telling it softly that it is loved. It is needed. It is important. It makes perfect sense. And love it just as it is in all of its agonizing beauty.
Hmm. That's wonderful. And I like your rationale for it. People, they may want to read a book and it may be helpful to read a book, but if you don't have bandwidth for a book or you can't focus your way through a book, that took you 10 seconds or so, to read that. And that's something I can do every day. And I can do it over and over again too. If one, resonates with me in particular, it's sort of like meditation, but reading something.
Exactly.
So,
That's what I'm finding people are saying to me. They're marking the ones that, and grief changes over time. So certain ones speak to people at different times. I kind of divided the book into three areas: early grief and middle grief and later grief when you're looking forward. And people tell me that they mark the ones that are speaking to them at that time and read them over and over. And I hope it gives people some comfort.
yeah, I'm sure it does. It gave me comfort listening to you read that one poem. So thank you for that. Do you, I'm sure when you started your practice, you were thinking about, okay, I'm going to work with people near where I am. COVID, you mentioned, changed that where people couldn't come to you anymore. They had, you had to adapt and use Zoom and whatever. Do you work with people sort of anywhere, Kara, or how do you manage your clients, your patients?
Sure. Yeah. In this country, therapists are licensed by state. And so you need to work with clients who are living in the same state that you're licensed in. So I do work with a couple people, training them in nonviolent communication who work in other states, or even I have a couple in Switzerland I'm working with. But in terms of therapy, I work with people in the state, but I actually before COVID had worked with people in other cities who had just heard of me through friends. So I had a little bit of online experience before COVID. Um, I I prefer working in the same room just because, especially with trauma work, it's really there's something just intangible about being in the same room with people. But I have found being online to be more effective than I had feared. I really feared it
Yeah.
uh, when we started. So I'm seeing people all over the state, although most of the people I see are still in my area. When I said I would go back to seeing in person when I was fully vaccinated, only about a third of my clients wanted to come back in person because it's so much more convenient to be online.
Sure.
So that kind of surprised me. Before COVID, they all thought they wanted to be in person, and after COVID, they said, "No, this is pretty convenient." So,
Uh, Believe it or not, I feel that way about a lot of things I was doing in person before as well. So, but you definitely do well in Zoom. I mean, I feel like I've had a great experience with you, and I don't know how much better it would be if I was sitting, next to you or across from you in your office. So, um, Kara, this has been so fantastic. Thank you so much for being on the show and helping us understand you and what you've been through, and of course what you help people with as well. It wasn't what I expected. I didn't know we were going to go all those places, and I'm glad we did, and I'm glad that you shared. And I know people can find out more about you at your website, which is karabowman.com, Kara. Is there any other way that you want people to connect with you?
No, I think that has information about me and a way to contact me if people are interested. Mm-hmm.
Okay, wonderful. Well, thank you so much for being on the show. I'm very, very grateful to have the chance to meet you and learn about you.
Yeah, I really appreciate the opportunity, and I really appreciate what you're offering to the world, the opportunity to hear from all of these people about their own journeys.
All right, thank you. Thanks for listening to this episode of the How'd It Happen podcast, where we believe that success doesn't happen unless you make it happen. You can subscribe to the podcast on Apple Podcasts, Google Podcasts, Stitcher, or wherever you like to listen. And while you're there, please rate it and leave a comment as well. I'd love to hear your thoughts about the show, ideas for future guests, or whatever you'd like to share. And of course, you can always find me at MikeMalatesta.com. See you next time. Thanks again for listening to the How'd It Happen podcast.